It was like an upside-down mushroom hanging in an odd upper corner of the stomach.
It's been almost 10 years since a routine screening detected a rare and very aggressive cancer inside Kathleen Kennedy Tuttle. Her doctor recommended surgery as soon as possible.
And I asked him, could I wait till after the holidays because it was close to winter holidays. And he said, you won't be here.
Terrified, Kathleen agreed to undergo a radical procedure that would remove the tumor and reconstruct her entire gastrointestinal tract. The surgery was successful, but Kathleen says she developed nausea during recovery that wouldn't go away.
I was desperate. It was like, what can I do? I'll try anything.
Her search led her here to the Virginia Thurston Healing Garden in Harvard.
Hi, Kathy. It's good to see you.
Julie Irvin is a licensed massage therapist who's trained to offer a special type of service called oncology massage.
It's massage that's to accommodate somebody who has a cancer diagnosis, whether it was yesterday or 30 years ago. You can have a seat in the chair. We do a much more in-depth intake medical form to see where that client's been, what has been their diagnosis, what is their treatment, what are the side effects that they're feeling, what are the symptoms from the cancer, and then create a really great experience for them that's going to be effective and safe.
For Kathleen, that meant lying only on her back instead of her stomach, keeping her head elevated to ease her airway, and using light touches to help her body relax.
I think that's been a big benefit to me in my healing process. I used to have a lot of anxiety when I first started, just, because the experience was so difficult. And now I don't have that.
This research study also found a single massage treatment resulted in acute relief of self-reported symptoms. Cancer patients saw the most improvement with pain, fatigue, anxiety, and sleep. And they say it also helps significantly with depression, nausea, and lack of appetite.
A big part of oncology massage is presence and deeply listening. It might be a simple hand massage. There's always something that can be done.
Well, here in Massachusetts, massage therapists must be licensed, but check with Society of Oncology Massage to confirm they've received extra training to work specifically with cancer patients. You can find more information on our website, WCVB.com, and of course on our app. Ben and Erica.